Hey, hey. Just in case you were curious, this is what your face looks like underneath all that skin. These are all the muscles that control your face. Who knew there were so many in there? So today I went to Penn Medicine to see Dr. Zhao, the facial plastic surgeon who specializes in facial paralysis. He's one of about 12 to 15 in the whole country. Kind of crazy. And he's down in Philly. And we talked about the DAO surgery, which they go in and remove this muscle. Gonna hold off on that for 6 to 8 months to see. We did medical Botox today. I was a little hesitant with that, so worried about that. Didn't like the thought of putting toxins into the muscles of my face to paralyze them, lessen their movement because it's already paralyzed. But the synkinesis, where these nerves, this is your facial nerve, they're supposed to attach to all these muscles. They've branched and they've attached to multiple muscles. It's called synkinesis. And I found out today about 1/3 of facial paralysis patients develop synkinesis. And I'm one of the lucky ones, apparently. So it creates more tension. So the Botox is supposed to help lessen that tension. He expects me to need that probably indefinitely every 3 to 4 months for the rest of my life, as long as I can afford it. So we did a minimal amount today. I took before pictures. I'll be able to compare next week. Hopefully it will help lessen with tension. And then she gave me this whole packet of stuff to do every morning, every night, which takes some time and it's not very comfortable, but helps to lessen some of this tension and asymmetry and pain that come along with the tension developed from the synkinesis. It goes all the way down into my neck and through the whole face. Always fun. So I'm grateful that there's a specialist that can do therapy. They just brought her up from Miami to Penn. So they want me to go every week, which is really hard to do. So I'm hoping to maybe just have to pay out of pocket to do it virtually. Have to figure that out. But hoping to get back there in the next 2 to 8 weeks to see her and the doctor and check in with the Botox. So if you know anyone that's struggling with Bell's palsy or facial paralysis, feel free to send them my way. I will share them all the things. And glad to see there's at least something that's very specific to this that can help at least with the tension and the pain and create a little bit more symmetry. So I'll keep you posted. Tell you about the Botox. And just in case you've never had Botox, it is not comfortable. But when they stick the needle, they stick it into the muscle. It sounds like it's like crunching burnt skin. It's very interesting. So if you've never had it, just in case you want to be prepared, have a good night. Keep you posted.